There's so much misconception about what a mammogram actually is. The mammogram has a horrible reputation that precedes it. But it is just technically it's x-ray of the breast.
And its ideal design is to catch early signs of breast cancer.
The reason that it's important to get a mammogram is because early detection is best. If you get your mammogram when you're supposed to get your mammograms and we find a cancer early, we can take care of it and get it done before it can spread to anything else.
Through the current technologies that we do have, we are able to detect breast cancers a lot earlier than you would be able to doing a self-exam at home or even going to your doctor's office and having them do a physical exam on you.
Beginning at the age of 35, women should have their baseline mammograms. At 40 is when you begin having your annual mammograms.
Particularly if you have a history of breast cancer in the family, that's an individualized discussion that you would have with your doctor to decide when you should start.
They could start earlier, annual mammograms, earlier than 40, depending upon the family history.
What should you expect when you come to get a mammogram? Well, it just depends on your attitude when you get here. So I think sometimes people come in here with the attitude of, or thinking that, this is gonna hurt, my mom says it's horrible. And they come in here and we do it and they go, oh, that didn't hurt at all.
Different women experience it differently. Of course, if you're on your menstrual cycle, if you have intake of caffeine, so certain things like that can affect your overall sensitivity level. However, most people walk out the door saying, oh my goodness, I can't believe it was that easy. I can't believe I didn't feel anything.
It's a lot easier now, a lot better. It doesn't take very long at all.
The patient's actually only going to be in the room for maybe 10 minutes. The actual procedure is, less than 20 seconds each position. That's just taking the time to position it and to make the picture.
If you have breast implants, we do take more images. We have to do pictures with the implant in place, which we barely touch you with the paddle. We do not compress the implant. And then we'll take pictures, what's called pushbacks. We push the implant back out of the way, get as much breast tissue as we possibly can.
We're all trained in doing it, and yes, you will have to go through 4 more pictures than everyone else, but it's not any worse.
I would recommend dress casually, comfortable, something that you can kind of get in and out of because you will be undressing from the waist up, so top and bra.
To be perfectly honest, it's an awkward situation. I mean, you can't avoid it being awkward, but they make it as comfortable as they possibly can. Only one side of you is exposed at any given time.
We recommend that you don't wear any type of deodorants or any type of lotion with glitter in it of any kind. The machine is so sensitive and it'll pick that up, and we definitely do not want you having to come back for something such as glitter or deodorant.
A woman should never be nervous about coming to have a mammogram. You should be nervous if you don't get a mammogram.
1 in 8 women will develop breast cancer in their lifetime.
And a mammogram is the easiest way to detect a breast cancer early.